Hi. When I say that I have had a chronic pain syndrome for a period of time, people usually give an impression as they understand it very well. But in reality, they have no clue what it means. How could they if they don't also live with the pain, which is unmanageable or out of control, day after day, months after months, year after year? A pain that lasts for 3 to 6 months or more is called chronic pain, and I'm going through it because of my post polio syndrome. About 25% of chronic pain will go on to have a condition called chronic pain syndrome, CPS. That's when people have symptoms beyond pain alone, like depression and anxiety, which interferes with their daily lives. I'm undergoing through that. It often starts with an injury or a painful condition. Mostly we can see that in people with arthritis or joint problems or back pains or those who have chronic headaches, migraines, those who have muscle strains and sprains, fibromyalgia, a condition that causes muscle pain throughout the body, a kind of nerve damage that is also very painful. If someone has broken bones, if someone has cancer, or with acid reflux or even ulcers, endometriosis, and even in post polio syndrome like me. I have pains all over my body, muscular pains, all throughout my day, all throughout my night. So if you have chronic pain, you may relate to how I describe it here. And if you don't, but care about someone who does, I hope this can be helpful. Like my mother has shoulder pain, she has chronic shoulder pain. What does living with chronic pain actually mean? It is experiencing life's best moments through the lens of discomfort. There is always a kind of discomfort. Or someone may even have part time jobs as professional patients in addition to normal responsibilities. We become professional patients, spending hours of the day trying to soothe and manage symptoms, or prioritizing moving our body even when we don't feel like it or have the time, not having the luxury to cheat sleep, diet, or exercise. So when people question us, not understanding why this week is so much worse than last week, or changing our life goals to accommodate our physical needs. These are all the side effects or a whole part of the package of the chronic pain. That life can still be beautiful and meaningful, even though it's harder. We all understand that. And what happens is that relating to others without pain is sometimes very frustrating. Because what does it mean? It means cringing when people say, I hope all is well, as though things could be all well when you live with the pain every day. Explaining to everyone that living with chronic pain is like, but still feeling that nobody understands. People making judgments about what we can do and what we can't because they don't understand the condition. Being more irritable and anxious because we are bombarded with pain signals all the time. And there are sudden mood shifts from joy to despair when pain signals become too loud. Even while sitting in a crowd, when we are even in a party, there can be mood shifts. And people start judging our state of health by our current job or recent social media pictures. Our loved ones are hurting because they want so badly to fix it for us, but they can't. And all this can lead to loneliness. It's hard to accept that having a daily chronic pain means attempting to hike to the top, but pain stopping you midway defeated, or being hesitant to run, ski, or dance, or to take part in any recreational activities. not recovering from normal bumps and bruises like other people, because or we need to skip a vacation because we are unsure whether we would be able to do the activities, or even traveling, trying to smile at a party when all we want to do is to curl up in our heating pads. It is like often having to say no or go home early. Sometimes we need to be selfish and unreliable. And on a deeper personal level, having a chronic pain means sometimes not recognizing our own self, not remembering what it feels like to be comfortable, occasionally feeling totally powerless and wanting to give it up, and being okay without not being okay. Finding ways to have hope that things will get better while also accepting the current reality is our reality. We try to discover a strength that we never knew we had inside us, and being proud of ourselves for continuing to fight. This is what living with chronic pain is like.